All right, again, well, if it's Thursday, on Fox Wilmington, we always bring in someone from the medical community to talk with us today. It is LeShonda Wallace. I apologize, LeShonda Wallace, if I could read what's written for me. She's with the New Hanover Regional Medical Center Physician Specialists, talking about internal medicine, most specifically the most preventable form of cancer I would think that's out there, lung cancer. And specifically when it comes to smoking, I don't want to say that they would put you out of business for what you do, but I would think that you would love to see this completely fall off the shelf. Are we seeing the numbers come down a little bit?
Well, what we do know is that lung cancer can be screened early. So the life expectancy of someone who could have lung cancer could be found out early and prevented. And that is through screening CAT scan that we do for lung cancer for those smokers who have smoked about a pack a day for over 30 years. For some people, it could be 2 packs a day for 15 years.
And this, the procedure, I knew you were reading about the x-ray, this very low dose, but at the same time gives you a much better readout than your regular x-ray, to where you're able to see things that you might not, if you go to your general doctor, they might not catch.
So what it is, it's a screening that is done for people that are asymptomatic, meaning that they do not have the typical signs such as a cough, sputum production, weight loss. And the screening is a combination of x-ray along with computer images that give the radiologist a real detailed image of your lungs, and they determine whether or not there are some early signs of lung cancer that you may not even be aware of.
If someone were a smoker, maybe thinking about quitting but just hasn't been able to kick the habit, how far after they started should they might be at home thinking, maybe I should go in for one of these?
Well, if you're the age of 55 and older, maybe about 80 years old, and again, if you smoked about a pack a day for 30 years, it is recommended that you are at high risk, and you should talk to your medical provider to get the screening done. The screening is done every year. But if you did stop smoking, but you had that habit of smoking, even if it's been at least 15 years, you still should have the screening done.
Yeah, it's amazing how, even though, as you said, you could stop today, how long this stays with you down the road, that you really need to stay on top of it. It's great that we have that right down the road. Well, LeShonda, I appreciate the time.
Thank you for having us.
Thank you this morning. All right, we go.